Good evening, and thank you for keeping it TV 47. You're just in time for the other episode of Body Garage here on TV 47 with I, Sheila Chelangat. Now, yesterday, the world commemorated the World Cancer Day. And so tonight, we continue the conversation as we handle now cancer screening and management. And tonight, in studio with me is Dr. Martin Kuria. How are you, Daktari?
I'm very good.
You keeping well?
Very good.
Yes. Now, when we talk about cancer screening, it's a big word. First, why should I not fear, the word cancer screening, and why should I not fear being screened?
Okay. I think that's a very good question. First of all, thank you for having me. And probably we need to start from what is cancer.
Yes.
So that we come to the reason why we need to do cancer screening. So cancer, simply put, is just an outgrowth of cells, because we understand the whole body is actually made up of cells. Now, these cells, which are the units which make up every organ that is in our body, now the growth of our cells, in essence, is what causes our body to grow and develop. Now, that growth and development of our cells is normally regulated by things that we call genes, and more specific DNA, which is actually found within our cells. Now, whenever there is some dysregulation in the way our cells grow, that's the origin of cancer. And therefore, this big name, because I know it has actually been scaring quite a number of people for the few years that it has been with us, that is cancer. So it's all about, cells overgrowing, or the body lacking a mechanism to regulate how cells are growing within the body.
Yes.
Now that leads to the more than 100 different types of cancers that can develop within the human body. So having said that, now I want to come to your question on cancer screening.
Yes.
Because we understand, even as we commemorate the World Cancer Day, now the world is actually at a time when cancer now is becoming a very big health burden. Currently, as we are speaking, in Kenya, cancer is becoming the third leading cause of death.
Yes.
And worldwide is actually the second leading cause of death. So that's why international bodies that deal with health, whether it's WHO, now are finding it very, very important now for us to get a way of controlling cancer as a disease. And there is no other better way of controlling cancer other than screening.
Yes.
So screening is a way of trying to detect that a certain person is having cancer way ahead of them having signs and symptoms, or what in the medical field we call clinical manifestations. And the reason why it's so important for each and every person, and here we are talking about not just the old people.
Yes.
We are talking about a human being in any age group, right from childhood right all the way to the very elderly, is actually a requirement for you to be doing a cancer screening. Okay, specific to the type of cancer which is more likely, to develop at your age group.
Yes.
At least once every 2 years.
Yes.
Because that's the one most best way of trying to detect whether you have any cancer growth within your body as early as possible, so that as clinicians we can be able to start the journey of trying to manage and treat cancer. Yes.
But even before we go to, someone actually considering to get a screening, perhaps, Daktari, you could remind us, what are some of the risk factors that can lead to cancer?
Okay, thank you. So I think there are so many risk factors that lead to cancer in general. So first of all, we have agreed we have more than 100 different types of cancers that affect the human body. Definitely there are those which are more prevalent than others. As we speak, the 4 leading type of cancers within our country that's Kenya. So we have breast cancer and cervical cancer for the ladies. And then we have prostate cancer and also what we call esophageal cancer for the male. Now, those four take up around 50% of all the cases of cancers that we have within our country. So we normally say in general, what causes cancer? And I want to start with what causes before I come to the risk factor.
Yes.
Cancer is caused by genetic mutations. You see, we said within our cells, we normally have what we call genes. Now, these genes, or what people could also call DNA, is what controls cell division within our body, because cells need to divide for your body to be able to grow. So the DNA or the genes that we have inside our cells can undergo something called mutation. So mutation is more or less a genetic breakdown. So it's a process that, you know, makes the way genes work or DNA works now to fail. When that happens, then now that's where cancer starts. So all that we classify as risk factors for cancer, indirectly, they are the causes of genetic mutations. So I would want to look at the leading risk factors for cancer. So first of all, we normally say there are chemicals called carcinogens. Carcinogens is just one word for all the various chemicals, you know, which can actually cause cancer. But the biggest known risk factors for cancer, first and foremost, is what we call family history or genetic predisposition. And we normally say this, just to simplify for our viewers, that in case you have a history of cancer within your family, and more so your first degree relatives. So here we are talking about either your parent or any of your sibling, so having had cancer, then there is a likelihood, not that you must get cancer, but there is a likelihood that you may also get cancer. So, and that's one of the reasons as to why you need, you know, frequent screening for you to be able to detect if there is any cancer cells that are actually growing within your body. So that is genetic predisposition. Then we also have the second one about what we call smoking and alcohol intake. More so in the context of our country, based on the four cancers I already talked about. Smoking and alcohol intake is a big, big risk factor for getting cancers. In fact, for smoking, we say worldwide, 70% of the cancers that we have in our body, you know, originate from carcinogens that come from tobacco use or tobacco smoking. So that's a very big risk factor. Then we also have what we call obesity or being overweight. Now that's becoming a very big risk factor, more so in this day and age of sedentary lifestyle, more so within our urban areas, although right now it's prevalent even within the rural areas, whereby we have really changed our lifestyle. So we are not doing as much exercise as we are supposed to be doing. So what normally happens, because I've had patients, you know, trying to get to terms as to how, you know, obesity or overweight can actually cause cancer. The moment you have too much weight, what happens is you introduce something called inflammation into the body. So when you are obese, so your body, we normally say, is always in a state of constant inflammation. So inflammation over a long period of time will actually now start causing genetic changes within your cells, which will later on now predispose you to different types of cancers, whether it is breast cancer, whether it is prostate cancer. You know, being overweight or being obese is actually a big risk factor. Then another one which is also very, very key is also diet. So diet is also a big risk factor for cancer. And when I talk about diet, I mean a diet, I'll say what it doesn't have rather than what it has.
Yes.
Because, you know, in the present day lifestyle, we have more bad food than the good food. So lack of or a poor intake of vegetables, fruits, and fiber is actually a leading cause of cancer. Because in the food that we eat, there are two types of nutrients that we can get that either can contribute or can avoid you from getting cancer. So if you eat the right type of food, that is a diet rich in vegetables, green vegetables, fruits, whole grains, and plant-based food, then you get what we call antioxidants from that diet. Antioxidants are actually chemicals which help to fight cancer cells. While on the other hand, now the poor diet, that is diet that is rich in refined sugar, you know, red meat, processed meat, and also carbohydrates, that one is more likely to cause cancer rather than prevent you from getting cancer. Yes.
Okay, Daktari, and with that said now, since we now have understood some of the risk factors, now let's go back to the cancer screening.
Yes.
What exactly does it entail when I decide that, you know, let me take myself for a screening? What should I look, you know, be prepared to get through?
Okay. Thank you so much. I think because we are talking, actually the theme for this World Cancer Day is more towards, you know, we are unified by being unique.
Yes.
That is, you know, we need the whole, you know, society to have a better look at cancer as a disease. Because the projections are that by 2028, this country, right now we have around 27,000 people dying annually due to cancer. So those numbers are likely to skyrocket to around 58,000. And that's quite a big number of people. Now, bearing in mind there are people who never get into the statistics books and they still die of cancer. So screening is very, very key. And we are really, you know, for people to go for screening. So when I decide to go for screening, now whether male or female, because there are certain cancers which are more gender specific. Like when you talk about cervical cancer, which is one key problem within our country. So that's totally for females. And here we are talking about the age group between 9 to around 15 years. That's the one that is actually targeted. Although a female at any age can walk to a health facility, you know, to do screening for cervical cancer. So first of all, there are some misinformed, you know, ideas about screening, and probably that has brought about the low, you know, number of people who normally come to the hospitals for screening, because most people would actually imagine, first of all, that it is costly, that it would involve interventions, and at one time it may also involve you being admitted in a hospital.
Yes.
So one thing you need to be aware is screening, first of all, is very friendly. In the sense that most of the screening tests that we are currently doing for the most common cancers, most of those 4. And here I'll be more specific with cervical cancer, breast cancer, and also prostate cancer.
Yes.
Because those are the 3 cancers which, you know, there is a lot of screening going on. So the screening tests, even where we involve a blood test, like in prostate cancer, we do the PSA test. It's actually a very simple test that will just take you a small needle prick. Then we get a very small blood sample from you, which we take to the lab, and then we're able to give you results, probably nowadays even the same day. So within a couple of minutes, at most an hour or 2, you have your results.
So it doesn't mean that I'd come and stay the whole day in hospital?
No, you'll not stay the whole day in hospital. And again, it's not costly. I think the government has really come in handy to try and subsidize the cost of most of these screening tests. And they're becoming more affordable for majority of the Kenyan population. So I think the fear that it might be costly is no longer there. And we will encourage people to really come, you know, for screening. You don't need to prepare yourself to come for admissions or to come with any equipment. We just need you as a person.
As a person.
And then we'll be able to do the screening.
Okay, Daktari, thank you for that. We would like to take our first commercial break. When we will be back, we will get to know now what next after getting the results from the screening. Do not go too far. Keep it TV 47. But first, take a look at some of our myths and facts of the day. Cancer is contagious. Cancer is not contagious and cannot spread from person to person, except in rare cases of organ transplants. Family history of cancer means you'll get cancer. Family history doesn't guarantee you'll get cancer. Most cancers are caused by mutations that happen during a person's lifetime. All right, thank you very much for keeping it TV 47 and of course Body Garage on this episode where we are delving into cancer screening and management. And Daktari, before the break we had just touched on what cancer screening entails.
Yes.
You've rightly put it that it doesn't take so much time. Within minutes I'd get my results.
Yes.
Now my question would be, what next? What should I expect now after getting my results? If it is a positive test results, what does that mean for me?
Okay. Thank you so much. And allow me to just take a minute to be a bit more specific on the screening tests for the 3 types of cancers which we are currently dealing with as a country. So for breast cancer, it's one of the leading cancers among females within Kenya. So the most common test that we do is what we call a breast mammogram.
Yes.
Or in some facilities which don't have the X-ray machines or the ultrasound, we can also do a breast exam, the physical breast exam. It is also considered as accurate enough in trying to screen for breast cancer. So I just want to mention the specific test so that a client coming or one of our viewers is able to understand, in case I want to be tested for breast cancer, what exactly will be done or which test I need to go for. Then for the cervical cancer, the second leading, cancer among females, for cervical cancer it's actually much more easier. We have something called a pap smear. Nowadays we even have one which you can be able to test by yourself. So at home. But it's always good to come to the health facility. Then we can be able to do a pap smear where we just get a small sample from the cervix. That is the mucosal lining within the cervix of a female reproductive tract. And then we can also be able to check for the HPV virus within the blood. So we have 2 tests. So we can do the pap smear at the cervix and also we can be able to do a blood test to check for the HPV vaccine. Then for the prostate cancer, some years back, this used to be a very big issue and brought a lot of stigma around screening for prostate cancer because there used to be a test we used to do called the digital rectal exam, which made males, most of the old ones, to totally never like coming to a hospital because that procedure was not very friendly for them. But nowadays we can be able to do just a blood test to check for just a small antigen which we check in the blood, and it can be able to tell us if this male either is in the early stages or they already have prostate cancer. For colorectal cancer, which is the 4th, we just do an endoscopy, which is also just a small camera that we put through the mouth, down into the stomach and also into the intestine. And also we can also do colonoscopy. We just insert a camera through the rectum, which can be able to view the inner lining of your large intestine. So having said that, so those are the tests that we do to screen for different types of cancers. So when you walk into any health facility and probably you want to do a screening test for a certain type of cancer, probably because, as you have mentioned, you know, you either have a family history,
Yes.
or you have heard that you fall under one of the risk factors that you have mentioned, and we do those tests. Out of all the tests that I have said, none of them will take more than a day. So you walk into the health facility, probably for a pap smear in some lower health facilities, so they will tell you to come for results probably after 2 or 3 days, but never to be admitted in the hospital. So once you get your results, now there are 2 potential outcomes. So one, your results may actually be negative. Negative in the sense that you don't have any cancer cells that are growing within your body. So definitely that will be the good news to each and every person.
Of course.
And what that would mean is that now you'll also be educated in most of these health facilities, given very specific health education on how you need to have a proper lifestyle so as to prevent yourself from getting cancer in the future. Because that doesn't mean if I'm screened today and the tests are negative, it doesn't mean that I'll not have cancer for the rest of my life. It's good for all of us to remember that cancer is more or less a non-communicable disease and a lifestyle disease. So lifestyle diseases develop over a long period of time. So, and some of the tests, we have to admit, some of the screening tests that we do are not very specific. So meaning they may not be able to detect cancer at that very time when you go for the screening test. But probably an year or 2 years after, then you may get, you know, now a positive test result. So it's always good, you know, once you get your results and they are negative, you know, that is what everybody would want. But that means now you need to take measures, appropriate measures to avoid you from getting cancer in the future.
In the future.
Now, the other potential outcome is that you can have, you know, your test being positive. Now, positive means you have cancer. And cancer, we normally stage cancer, you know, differently. For instance, you may be told, you know, you are in cancer stage 1, stage 2, stage 3, stage 4. Most cancers, we stage them into those 4 different levels. Now, it is totally impossible for someone to walk in, because with screening, we're imagining this is someone who is healthy.
Yes.
Because when I go for screening, I'm healthy, it's only that I don't know whether there is any cancer in my body. So that would mainly be cancer stage 1 and stage 2, that you might be tested and is detected that you have the cancer in the early
stages.
stages.
As you say that, Dr. Ari,
Yes.
does it mean then that those results, you said that you can detect either stage 1 and 2.
Yes.
Does it mean then that result is a diagnosis already?
Very true. Actually, with cancer, for instance, if I take an example with a mammogram, if I do a mammogram because it's an X-ray that is able to view the breast tissue, at the point of screening, the goodness with screening, it can also be a good diagnostic test to confirm for you, you have cancer, and this cancer is at this particular stage. So, but there are those which are a bit not very specific. For example, the PSA for prostate cancer, the blood test, it can only tell us this individual has cancer, but we need to do some further tests for us to confirm which stage is the cancer, because staging of cancer is very important, because it's the one that will direct us into what modalities will we use to treat and manage this patient who has the cancer. Yes, so when the test is positive, now it can also be a point where this patient, if I may call them so, because now they have the disease, we are able to know which stage of cancer they are in, so that you can able to decide, how to start the journey of management of cancer.
Yes.
And
for people who normally live in denial, or maybe those results would be shocking when they see a positive test result, is there a likelihood, or let me phrase it as this, how accurate are these results, oftentimes?
Okay. That's a very good question, because as you have said, I think there's so much stigma around cancer, and probably it's one of the reasons as to why most people would rather not come for screening. They will say, I better know when I already have the disease.
Yeah, precisely. Enda kutafuta nini.
Yes, rather than have the bad news when the cancer is at the early stages. But actually it's the other way around. For us who see these cancer patients on a day-to-day basis, I would actually advise people, it's way, way better for you to detect and to know you have cancer at an early stage. For the one and very reason that once cancer is detected early, you see all those 4 cancers I've mentioned,
yes,
and probably you are at stage 1, and then we start the management and treatment at that very time. Trust you me, you can be able to have full 100% recovery from your cancer. Because the thing with cancer is, by the time you start getting the signs and symptoms, and you have physically, you now start appearing you have the cancer, which is mainly a stage 3 and stage 4, then the chances, not that you can't fully recover, but the chances are way less compared to if cancer was detected early. And I think, people are getting more knowledge about cancer, and they are embracing it. And we have very many cancer survivors out there. So therefore, people shouldn't fear, screening and knowing whether they have cancer
or not.
Because once you know that you have cancer, we normally have, the team that is normally involved in management of a cancer patient is not just the oncologist. That is the doctor who is, targeting and managing these cancer cells. We also have a nutritionist on board. We also have a psychologist on board, so that we are able to manage this patient holistically, so that we can be able to cater for all their needs. So let people not fear that they have it, but we always see patients who are in denial. So they're told, especially men, for some reason, you'll tell a patient, now we have confirmed you have prostate cancer. Definitely, some of them, because at the point of screening, you look healthy and you're okay.
Yes.
So you'll actually start doubting whether for sure you have cancer. So, but as you said, it's always good. And even as a hospital or as clinicians, we always want to do another test.
Okay.
So at the screening point, that is just an indicator you have the cancer, but you'd always do another test just to confirm for sure whether this is cancer. And mind you, we need to get this right. When I do a mammogram on a patient and identify there is a growth, now the only confirmatory test to tell me that for sure this is cancer, we have to do a biopsy. So we have to take a small sample of that tumor or that growth, take it to the lab, then a pathologist will be able to look into those cells and now identify that for sure these are cancer cells.
Okay.
So a simple test will still not be confirmatory as good as it is. We still need those lab results from a pathologist.
Okay.
Yes.
All right, Daktari, we are up for our second commercial break. We have just learned so much on this screening. Now, when we will be back after the break, we will now talk about the management bit of it. Do not go too far. Keep it TV 47. Welcome back to the last part of our episode today as we focus on cancer screening and management. And Daktari, before the break, we were talking about now the positive and negative test results.
Yes.
So before we get even to the bit of management, what about now for a person who got a negative test? How often then would you advise them to go for, screenings?
Okay. Thank you. So we had earlier said that cancers can appear at any age.
Yes.
So we get children getting cancers like leukemia, but general statistics normally tell us, there is an increased incidence of cancer with an increase in age. So that will go without saying that, the older the individual, the more likely they are to get cancer. So therefore, we normally say anyone above 40 years of age, male or female, it is very advisable to be doing a screening test for cancer once every 2 years. If it is a male, for prostate cancer, we like them doing once. If you have done the first test and it's negative, you always advise to repeat after every 3 years.
Okay.
But if you have never done, or there was a risk, then you should be able to repeat after every 2 years. For females on breast cancer and cervical cancer, so it's always advisable to do a screening test once. For females, below the age of 40 for cervical cancer, once every year. As long as the female is sexually active, once every year. Then for breast cancer, because nowadays we can be able to do even a self breast exam, that can be done as frequently as you can because you can do it at home. But if it is for the mammogram, you can do once every 2 years.
Once every 2 years.
Yes.
Okay. Now, I'd like us to move to now the treatment bit of it and management of it. You had mentioned that there's stages 1 to 4.
Yes.
How do you, stage that someone is in stage 2? What do you look at? Is it just their physical symptoms? And then how does that then guide you in the treatment of the patient?
Thank you. So we said when we are diagnosing cancer, so we start with the screening, and probably now we start with a positive test when we screen. Then later on we have to do a biopsy.
Yes.
That's always a must. So because cancer, we said, is an overgrowth of cells. So there'll be a swelling, or what people call a tumor, quote unquote. So we have to go in and take a very small sample, or cut a small piece of that tumor, take it to the lab. Then we have a doctor called a pathologist who will be able to view the cells of that biopsy to confirm that these are cancer cells. Because the one thing that we sometimes get wrong, not every other swelling or tumor that you have in your body is cancerous. So it's only upon, doing that biopsy that we can for sure confirm that this is cancer. Now, the same pathologist, when he is viewing those cells, so we combine 3 things. So the pathologists, as they are viewing the cells, they are able to see how abnormal the cells are. Or if I may use a simpler word, how cancerous the cells are. So that will actually guide in staging the cancer. So are we in stage 1, stage 2, stage 3, stage 4? So we'll get a report from the pathologist to tell us, how we, in the medical field, we call them how differentiated are the cells, how abnormal are they. Then we'll also look at the image of the tumor, because when we do the radiological tests, either an MRI, we also do a CT scan or even an ultrasound, we are able to view this tumor. And then we can be able to tell, is this tumor still located at the foci where it actually originated? Because I'm sure by now most people know that cancers normally metastasize, or it can spread to other organs. So for instance, I can have breast cancer, but then the cancer cells can spread either through our blood vessels or lymphatic vessels to nearby organs. where the cancer has already spread probably to the lungs or even to the liver. Now that also helps in staging because cancer at stage 1 will be at the point where the cancer started.
Yes.
So it will not have spread to any other part. So in stage 2 is when the cancer now starts spreading to nearby blood vessels and tissues, the normal tissues. Stage 3, the cancer now has spread to lymph nodes and nearby organs. Then stage 4, in most cancers, it has already metastasized all over the body. Now, clinical manifestation, how the patient looks like clinically, is not a very good measure of the stage in which the patient is. Because especially for the earlier stages, stage 1, stage 2, and stage 3, more so stage 1 and stage 2, the patient more or less looks healthy. So, but stage 3, definitely when you're in stage 4, the patient will already have started developing the signs and symptoms of cancer. And the most general one is this rapid loss of weight. So where the patient notices, for example, in a period of just a month or 2, I have lost 10 or 20 kgs. That's what the patient will tell you. So, and also probably some other things like loss of appetite, the body, you lose energy of the body, so the guy gets, very low energy and they get easily fatigued. So those are more or less the general symptoms. The others will be specific depending on where the cancer is. For example, if it's a breast cancer, you'll have a lump or a growth in that particular part of the body. Yes.
Okay, and so now take us through now the treatment options for the various stages.
Okay.
For stage 1, will I necessarily have a surgery for it?
Yes. So maybe before I specify them with the stages, cancer as a disease, we only have 3 options in management of cancer, irrespective of the stage where it is. So, and the options we have is 1, surgery. So where you go in and excise, or quote unquote, you go and cut and remove the cancer or the growth. So that's surgery. Then we also have radiotherapy, where we use radioactive rays, very strong ones, not like the ones that you use for x-rays, which can be able to penetrate through the skin of the patient, and they have the capacity to damage and kill cancer cells. We call that radiotherapy. Then the third option is chemotherapy. Now, chemotherapy is where we use cancer drugs. So these drugs either taken through the mouth or they can be given into the blood. Now, drugs designed, very strong ones, which also target to damage and kill the cancer cells. Now, those 3 options are not used independently of each other. For instance, most cancers in stage 1, when we are deciding which treatment option to go for with a patient, it is not just about the stage. So we also have to consider the age of the patient. Probably this is a child who has a lymphoma. So different ages would best fit a certain type of management of cancer. But what I may give as general guidelines, now the earlier the stage of the cancer, the more likely it is that we will use probably just chemotherapy or radiotherapy. And then, as the stages now go higher, stage 3 and stage 4, when the cancer is bigger, then we have to do the surgery. And it will not just be done independently. So we combine the treatment, whereby in stage 3 and stage 4, we'll first take the patient through radiotherapy and chemotherapy. Let me give an example. Probably this is breast cancer. So the patient is in stage 3. So they have this very big growth in their breast. So we cannot just go in and do mastectomy. That is just removal of the breast. So the patient must first be done radiotherapy so that you shrink or reduce the size of the tumor. Because radiotherapy and chemotherapy can be able to reduce the size of the tumor so that you can now go and be able to do surgery. Then even after the surgery, the patient will still be done radiotherapy and chemotherapy. So it is not really the stage per se which will determine whether we'll do chemo, radio, or surgery. It is the profile of the patient, the age of the patient. Remember also the patient has to choose. The doctor or the physician does not have, the right by himself to actually choose. What we do, we give the patient the options that they are. So you can either do surgery, we can do chemotherapy for you, and also radiotherapy. So, and it's good for our viewers to know the patient decides for themselves. So all we do is advise them. This is, if we do surgery, this is likely to be the outcome. These are the benefits. These are the side effects. If we do chemo, because there's also a cost attached to each of them. They don't come, each of them at the same cost. So the patient has to choose which they feel is a best fit for them. Yes.
And for now, these different options of treatment that you have mentioned, do they have any side effects? Are there any long-term side effects on a patient that someone should, wait on?
Thank you for that question. If I don't know whether any of our viewers, probably they know a cancer patient who has undergone treatment. The biggest challenge in management of cancer is the side effects of the different management methods. And that has actually been a hindrance to patients adhering to the medications or to the treatment. Whereby, if a patient, for instance, other than surgery, but for chemo and radiotherapy, they normally have very, I don't want to use a strong term, but it's just good for our viewers to know that these are expected challenges in the journey of treatment of cancer. Whereby we normally say it loosely, it first has to get worse before it gets better. So once you start treating cancer today, if a cancer patient starts taking the drugs and also undergoing radiotherapy, they realize the symptoms actually get worse. In fact, most of them would come back to the hospital and say, I'm actually getting worse than better. And most of them, we may forget, they would actually, some of them totally stop taking the medication or even the radio, fearing that it is not helping them. But that's how it is. Because as you take the drugs for cancer, those drugs and also the radiotherapy, they also end up damaging some of the normal cells in the body. So the most common side effects that you'll get with chemo and radio, we know one is what we call nausea and lack of appetite. Very, very common and very bad nausea. Sometimes you also get gastrointestinal problems. Either you get diarrhea or constipation, either of the two. We'd also get some patients also having hair loss. Very common, most of us have seen, because cancer medication and also radiotherapy, cancer cells, we say, they're highly dividing cells. We also have other cells in our body that also divide a lot, especially the skin cells together with the hair. So as a side effect, the moment the body is introduced to radio or chemotherapy, then hair cells, so they start dropping off. Not that that will be permanent, it's just for the period when the patient is taking the drugs. So, and also some get some skin changes, you get the color of the skin, and also the texture of the skin may change, the skin becomes very, very dry. So those are most of the side effects. And also, the energy within the body, the patient gets weak. Now they feel, I was coming with cancer, my body was weak, now with the medication it's getting weaker. It's just getting worse. But what I should mention is that the side effects, as long as the patient perseveres, it's just in the early stages. A month or so before the body gets used to the drugs. Then once you get through that phase, then you start the recovery phase.
Okay, Dr. I have 30 seconds. I want to ask you is, now when someone who is undergoing the treatment, how would you advise them to take care of themselves in just like 30 seconds and adhere to the treatment?
Okay. So one, the main thing that I would actually say is accept and be ready for it to get worse before it gets better. Just, and keep to your clinic dates, and also keep taking your drugs, because even the side effects that you see are just due to the medication that you are taking. But in the long term, you know, the recovery, you'll enjoy it way better than stopping the treatment.
Okay,
Yes.
Very wise words from you, Dr. Martin. Thank you very much for gracing our set today. It has been a lovely conversation. Thank you so much.
Thank you also for having me. Yes, and thank you also for our viewers.
All right, thank you. We are getting to the end of Body Garage, where we were discussing cancer screening and management, and I do hope that you are actually considering to get a screening, not because you have these symptoms, but because, you know, you're looking out for yourself and ensuring that you are better every time. Thank you for always keeping it TV 47. I am Sheila Chelangat. Until next time, it's good night.